Thank you. On behalf of UNAIDS, where I work, I want to thank FIGO for inviting us to participate and collaborate with the International Association of Gynecologists and Obstetricians. I want to talk about two very specific targets that are due to be completed by the end of 2015, 3 years from now. One is to eliminate new HIV infections in children and infants, and keeping mothers alive. Now, these are two critical targets in the AIDS response, and they have been a dramatic success in Europe and in North America. Here in Italy, virtually no child is born with HIV. However, in middle and low-income countries all across the globe, nearly 400,000 infants are born with HIV, and we continue to lose mothers from AIDS. We hope to eliminate all 400,000 in the next 3 years. A monumental task, but technically achievable, financially achievable. But one of the ways we know we can achieve it is in close collaboration with organizations like FIGO. And there are two key areas where they will play a role. One is to ensure that the standards, the medical standards for dealing with transmission from mother to child, it is the state of the art. It is the most up-to-date, the most effective drug regimens, the most effective techniques. But the other area where FIGO can help is with the profound stigma and discrimination that continues to surround AIDS. And we see that even within the medical profession. It can be very subtle. It can be just a disapproval by the physician. How dare you, as an HIV-infected woman, would you get pregnant? That's irresponsible. All the way to being denied services, releasing of confidential HIV testing, and an area that's growing in the media is forced sterilizations of women who are HIV positive. FIGO has been one of the most courageous and clear coming out against stigma and discrimination within the healthcare profession, and have recently endorsed a major statement about the basic principles whereby surgical contraception can be used. So we look to them for the technical medical side, and we look to them for the champion roles that they can play, the political roles that they can play to try to reduce stigma and discrimination within the health sector. Thank you.
Thank you very much, Dr. Paul, and I think you have heard a lot about FIGO, so I don't need to say anything. But however, just I brief you that FIGO is the acronym for the International Federation of Gynecology and Obstetrics, so Fédération Internationale de Gynecologie et Obstétrique, because it started actually in Geneva by the great man de Hauteville. So that's why it is a French name, and they find it is FIGO.
Federazione Italiana di Ginecologia e Ostetricia. Sorry, I love taking all
and we have 124 member societies all over the world, in the developed and the developing world. And by the end of this meeting, after our second General Assembly, will be 125 member societies. And so we encourage member societies at various countries to join us because we are a federation which has a vision and a mission. I think you have this in your report, I don't need to repeat it. And in order to conduct our mission, we collaborate with international organizations, which you see them on the head of this table, as well as with other organizations, other donors, etc., in order to implement to the grassroots obstetrician gynecologists who are member of our member societies, because we deal with societies, and societies, they have their members. Say the Italian Society of Obstetrics and Gynecology, it has, I believe, about 10,000 obstetrician gynecologists or even more, right? More than 10,000. So, and all belong to the Italian Society of Obstetrics and Gynecology. So this is the same as happening all over the world. We have membership of member societies. So through our contact with member societies, then we can relay every information or every advice which is needed by the society. And consequently, we have been working on capacity building of member societies so that they can influence policy in their own countries. They can be advocates for women's reproductive and sexual rights. They can be advocates at the policymakers, at the healthcare, at the parliamentarians, and at the top official members in their own countries in order to implement this concept. But at the same time also, they are healthcare providers, so they provide service. And consequently, it is important to work with them to improve the standard of healthcare to be cost-effective, evidence-based, and it is patient-centered as well. Because what's applicable for a woman here in Italy might not be applicable for a woman in the remote villages of Egypt or Nigeria. So patient-centered, evidence-based treatment is extremely important, and adaptation of the various technology to the needs of the patients, the grassroots patients. To do this, of course, we do need the assistance of the international organization. Professor Oshtemen, he spoke about fistula. We have a project with UNFPA to establish, and we did establish 5 training centers for the prevention and treatment of fistula, where we train doctors on the prevention and treatment of fistula. We have projects with Bill and Melinda Gates Foundation, where we work on capacity building of member societies in 9 centers in 8 countries in Asia and Africa. And the capacity building of member societies is extremely important, because what has been happening in most developing countries, a large number of these societies were just a briefcase society, which means a society with all its papers in the briefcase of the president of the society. Once the president goes off, that's it. Everything collapses and there's nothing. So we worked on the capacity building of these societies, on strengthen them, empower them, so that they become effective in their country, and they get the government involved with them, and they collaborate with the other professional organizations, like the midwifery, the pediatrics, the anesthesia, and then they can really be an advocate for the women's reproductive sexual rights. And also, by involvement of the government, they are in a better position to talk to the government, and consequently we ensure sustainability, so that when our assistance through Bill and Melinda Gates Foundation or others goes, the whole thing does not collapse and it will continue. I think I will stop here, and then I think we'll be very happy to receive questions from you.
Thank you, Professor. So while our colleagues think about questions, because it is very hard, the first question, I would ask to the lady and the gentleman if they have anything to add to what Professor Saror said. In the case not, please, any question. Yes, Dr. Ozotimehin.
I think it's also important to put into context that UNFPA, the United Nations Population Fund, is the global organization that provides family planning for women around the world. And we want to highlight the fact that as we speak, 222 million women in the developing world require family planning, and they are not getting it. And we are working with FIGO to raise awareness around that, so that we can get governments to do more, also to ensure that we build the capacity of gynecologists, obstetricians, nurses to be able to provide that service, and to ensure that we can meet that demand. If we meet that demand, we actually reduce the number of women who die in pregnancy or giving birth by a third. So it is a significant part of maternal mortality. And I think that is one thing that I want to highlight.
Thank you. Dr. Boussoret? Oh, sorry, Professor.
No.
One more thing to add is from the World Health Organization, what we do, we work with experts, and many of the experts are actually from professional association and organization, and many of them are from FIGO, from CIGO, the Italian society. And we create the norms and standards. We call them guidelines, which is a very boring word, but what they are, they're actually documents that describes what the best standard of care is based on evidence and science that has been filtered through the discussion with many of the experts. And for example, this week we are releasing our guidelines for postpartum hemorrhage that is in fact on our website and is distributed for all of the members that are here, and they are crucial not only because they help us formulate those guidelines, but also because, as Professor Cerusa have explained, they are the providers that provide those services, and therefore they are the ones that can uphold those standards of care.